I'd like to welcome everyone to my talk about Continuum. I'm Steve Lewis. I'm the editor-in-chief of Continuum. I learned today, I'm in my fourth year. I thought I was in my third year, but my fourth year as editor-in-chief. And I want to introduce a few people in the audience who are very involved with Continuum. First, Andrea Weiss is the executive editor for Continuum and several other publications as well. And Deborah Zollner, who's one of our copy editors, so very, very involved in the quality of our product. Before I start, I'd like to ask how many of you are Continuum subscribers? Great. Continuum users? Okay, okay, great. So I have probably about a 10-minute talk, and we'll be opening up for questions afterwards. And I want to talk a little bit about what Continuum is and the process of Continuum and how we produce an issue. So you all know this is what an issue looks like. This is the most recent issue, the one that just came out in April, which was, I thought, a really, really nice issue that Dr. Finger, who was our guest editor, did. I'll explain to you in a minute what a guest editor does. So what is Continuum? Well, we have a mission statement and a vision statement, and this is the mission statement in the issue. That Continuum Lifelong Learning in Neurology aids neurology professionals, mainly neurologists, but other neurology professionals, in improving the clinical care of patients and in demonstrating continued competency. And our vision statement is currently that Continuum will present the highest quality, in-depth information on topics in neurology and be the premier continuing medical education publication for neurology professionals. Again, mainly neurologists, but it should be relevant to other people who take care of neurology patients. So we have a core topic list, and what a core topic for us is, it's a topic that will be covered over will always be covered over a 3-year curriculum. So we have a 3-year curriculum. There are 6 issues per year, which means 18 issues over 3 years. And within that 3-year curriculum, these topics will always be covered. So there will always be an issue on cerebral vascular disease, dementia, demyelinating disease, epilepsy, headache, movement disorders, muscle disease, neurocritical care, neurology of systemic disease or medical illness, neuro-ophthalmology or neuro-otology, peripheral nerve disorders, psychiatry and behavioral neurology, spinal cord disorders, neuro-oncology, and neuroinfectious disease. As I mentioned, I took over this job about 4 years ago, and before I took over the job, there were 12 core topics, so I increased it from 12 to 15. I believe, if I recall correctly, we separated neuromuscular sort of nerve from muscle, so now there are 2 core topics where there used to be 1. So now we have nerve and muscle as 2 separate core topics. And we also separated, I believe, psychiatry and behavioral neurology from dementia. So prior to separating that, you could be 6 years, for example, between psychiatry issues, or even 6 years between myopathy issues. I just thought it was too important to cover these things every 3 years. So we also took away genetics. So genetics, which is incredibly important, of course, as a topic, I don't think it worked that well as an actual core topic. So even though it's core to neurology, it is actually core to many of these disorders. So genetics articles show up in the appropriate issues. So genetics of dementia will be in a dementia issue. Genetics of stroke will be in a stroke issue, but it won't be in a separate issue. So all of these topics are covered every 3 years. So that leaves essentially 3 non-core topics or 1 non-core topic per year, which is 3 every 3 years. And the ones that are coming up in the next year or so are pediatric neurology. We often have 1 pediatric neurology article per issue. So pediatric headache would be an article in a headache issue. But we also thought it was important to have a pediatric issue. It's been a long time, and people really do need one place where pretty much all the pediatrics and adult neurologist needs to know will be in 1 issue. We have another issue coming up next year called Common Disorders in Ambulatory Neurology, and another one called Sleep Neurology. Now, this is an interesting issue. I found that there were some topics that were really important. I'm a general neurologist, by the way, for those who don't know. So I see all kinds of patients, and there's some topics that are really important that we see all the time, but they just don't fit into a typical continuum issue, like Bell's palsy and trigeminal neuralgia and carpal tunnel syndrome and a lot of the and syncope and so on. low back pain. These don't really fit into the other core topics, so I wanted to be sure we covered them. So I'm not sure if this will be the final name of the issue, but that's the concept. It's kind of a potpourri issue of important things that I'd like to include in our 3-year curriculum, but just don't fit into a typical subspecialty issue. So how do we create a continuum issue? So I should, before I go through this slide, I should mention there's an editorial board. One of our members is there, Dr. Softy, is an editorial board. So we have about 15 members of the editorial board. So I'm the editor. We have several associate editors. Dr. Softy is recently named as the associate editor for self-assessment and CME. So he's involved in the editing of the CME questions and the patient management problem. We have an associate editor for practice, associate editor for ethics, associate editor for neuroimaging, and so on, and another associate editor sort of for the whole thing, Dr. Zollinger. But so the editorial board meets twice per year and talks about strategy and gives me advice about possible guest editors and so on. But the day-to-day work is me and Andrea and our and our team in Minneapolis. So how do we create an issue? I invite a guest editor. And how do I invite a guest editor? Who do I choose? Some of it is based upon people I know who are experts, who I think would be good guest editors. Sometimes I don't have as much knowledge about who would be an appropriate guest editor. I'll get those recommendations from the editorial board. But once I decide who to invite, I invite that guest editor, and hopefully they agree to do it. I then discuss with that guest editor by email and by phone call what the topics should be. So my concept of continuum is that in that issue, whether it's dementia or stroke or demyelinating disease or whatever, should pretty much be everything a neurologist needs to know now about that illness. Yes, it was covered 3 years ago by definition, but that issue, by the time we create the new issue, as far as I'm concerned, doesn't exist anymore. We have a new issue that should be everything you should know about that entity. So I kind of negotiate with the guest editor what those 9, 10, 12, we've had some bigger issues, even 14 article issues, what those articles should be that will give the breadth of that topic, the appropriate breadth of that topic to neurologists. So again, we negotiate, we go through, we decide what the titles will be, because I think the title of the article is really important, because once we choose who the author of that article will be, if our title isn't quite right, they're not going to write the article that we want them to write. So we decide the article topics and titles. The guest editor then tells me who they would like to invite to be the author of each of those, let's say 10 or 12 articles. And I will typically approve those people, and the only time I wouldn't approve is if there was some history that that person was not good with deadlines in the past or something. But anyway, so we will then invite those authors, and they will have a number of months to write the article. Those articles are then submitted to the guest editor. So the authors write the article, submit it to the guest editor. The guest editor reviews it, makes any corrections, sends it back to the author if there's something that needs to be changed or added, and so on. Then it is sent, and I may have some of this in terms of where the copy editing occurs, but I think I have it right. So submitted to the guest editor, the authors may make some revisions at that point. It then comes back to our academy offices, where there's both peer review, meaning we have 3 reviewers of each article. These are actually peer-reviewed articles, so we have an editorial board member who, as a peer, who reviews it. We have a content expert who reviews it. And who's our third reviewer? I'm sorry, and a general neurologist a reviewer. So we have 3 peer reviewers who look at each article. We have our clinical pharmacist review it. So we have somebody on our editorial board, essentially, who is a terrific clinical pharmacist, knows a lot about neurological pharmacology, our therapeutics. And she'll review it for appropriateness of dosing, indications, and so on. She can't make changes, she can make suggestions to me, and then I finally decide with the guest editor and author if these changes need to be made. But the most important thing she does is check dosing. And we have Dr. Metzler, who's a neuroimager in New York. He reviews the images for that the arrows are in the right places, that the quality is good, that when we call it a flare image, it's really a flare and not a T2, and it's coronal and whatever. So he reviews that all. It gets copy edited by we have two copy editors, Deborah, who you met, and Rebecca in Minneapolis, and then gets sent to me for review, and I read them very carefully as well, and there may be, in fact, there often are additional changes that I suggest at that point, and then they go back to the authors. So the authors have to go through, the articles have to go through lots of steps, and the authors are sometimes surprised at how many steps, but we really think it's important that it's seen by all these people and finally me before we decide that that article is ready to go to press. It is then submitted to the publisher. We get, a few months later, the proofs. We review that actually in 3 steps. So the proofs comes back in 3 steps. And finally, it comes in your mailbox. And that's how it works. And this, again, is the finished product. This one just came out. This was the dementia issue. And again, I was really proud at how this really covers, I think, the gambit of things that you need to know. And that's the issue. So what is Continuum? Is it a review article journal? Is it a course? It was kind of created as a course, interestingly. And I never thought of it as a course. I thought of it as a review article journal, but it really was created as a course. Is it a textbook? Are these chapters and not articles? Oftentimes people say, I'm running a chapter for Continuum. Well, these really are peer-reviewed articles, but they're kind of like chapters. Is it an online or point-of-care resource? Is it a reference you keep on your shelf? I think it's all of the above, actually. Interested to see what you all think when I'm done with my talk. There's something else you may not be aware of, and that's the World Federation and the American Academy of Neurology have a collaboration where in developing countries, Continuum is a certain number of hard copies of Continuum are sent out. They have Continuum courses. They have online access. This is just a graph of, it's hard to read, but all the countries that are getting some small batches of Continuum to help them with their education. And this is just showing that the online usage is about 2,400 people using Continuum online in these developing countries in 2015. So there's a fair amount of usage of Continuum worldwide, and we think that's a very important part of our role as the developers of Continuum. So, you know, what is it? As I said, I think it's all of the above, but ultimately, hopefully, it's something that is indispensable to each of us in our care of our patients. So we take it as a very important responsibility to try to give you a product that really, really will help your patients and your care of your patients. So this was, I think this is my last slide. This was the peripheral nervous system disorder issue, which was jam-packed with articles, which is just, I'm just using to illustrate why. Is it a course? Is it a review article journal? I just felt it was really important that we included pretty much all the topics that a neurologist would need to know within looking at the entities from the anterior horn cell to the neuromuscular junction all in one issue. Because if I didn't cover them here, it would be another 3 years before they'd be covered. So that's why sometimes you'll see some issues that are bigger than others, because there's just a lot more to cover.